Hello everyone, welcome to Sengendai Higashiguchi Dental Clinic channel. I am Dr. Akikusas. This video has English and Vietnamese versions, so you can choose the preferred language version to watch. Have you ever had a throbbing toothache suddenly? This pain may be a symptom that the tooth decay has become worse. First, let's look at the structure of the tooth. Tooth can be simply divided into three parts. Start from the outside the enamel, the dentin, and the pulps. The enamel and the dentin are hard and protect the soft pulp inside. So, how does tooth decay process when it develops? Tooth decay is the infected male and whole, and the cause is bacterial infection. As the infection progresses, it breaks through the enamel, dentin, and eventually reaches the pulp. When the bacterial infection reaches the pulp, it's called throbbing pain and makes you unable to sleep well. This is pulpitis. As the pulpitis progresses, the pulpit dies, and the infection eventually spreads out of the root. The bones around the root melt and accumulate pus, which can accompany not only by pain but also swelling. This is apical periodontitis. Both pulpitis and for apical periodontitis, the method of treatment is to get rid of the bacterial infections. If it is pulpitis, the sphincter where there is a pulp, and if it is apical periodontitis, the sphincter where there was a pulp. It is necessary to thoroughly clean it. This treatment is a root canal treatment. The root canal means the tube that passes through the root of the tooth. Nowadays, the specific method of root canal treatment can be divided into mechanical and chemical approaches. The mechanical approach mainly illustrates the needle line cutting tool called a file. The operator grabs the stainless steel file with finger and rotating it manually, spread to the wall of the root canal to remove the infection. There is also the nickel titanium files, which can help remove bacteria more flexibly along the walls of the root canal, not just manually. It is rotated by the power of the motor to remove the infection, so it can be spread efficiently in the standardized forms. By advantage of the feature of the two files, root canal treatment will be processed while effectively using them. In the chemical approach, the root canal is mainly disinfected using a chemical solutions, such as sodium hypochlorite solutions. This method eliminates the infections and cannot be removed by a mechanical approach alone. Currently, most insulin medical institutions in Japan have a microscope and CT. If the morphology of the root canal is complicated, use microscope to magnify the structural field, and take a CT scan to make the root canal three-dimensional image. By grasping the morphologies, treatment can be processed more precisely. After cleaning, a rubbery recess called gutta percha is back in the root canal, and then the covering is done. Treatment is complex by preventing the bacterial infection from penetrating the recess. In addition, even if the pain disappears, if you leave it without covering or filling, it will almost certainly be reinfected. The pain may become more painful and the treatment also become more difficult, so do not interrupt the treatment. We have a talk about how to cheat so fast. But unfortunately, there are times when root canal treatment does not cure your disease. That's when the infection is too large, or the discs are cracked and the infection cannot be removed. Doctor may try to preserve the disc with a surgical approach. But if the condition is bad, it will become a tooth extraction. By the way, about the treatment cost, if you have an insulin cat that's taking 30% burden, the first time is 2,000 to 3,000 yen, so about. After that, it's got about 1,000 yen 8 times, and the final costs about 5,000 yen. Some cover are not included in insulin, so please consult with the doctor if you wish. You have to pay full cost if you do not have a health insurance card. Root canal treatment is difficult treatment, so don't lean on root canal treatment in the first place. Instead, it is important to regularly visit dental clinics for examinations and cleaning. Also, if you start root canal treatment, the situation will worsen if you interrupt it. So please be sure to continue the treatment until the covering and filling is complete. Thank you for watching video until the end, and see you in the next video.